Hello, and welcome back to Office Hours, where I answer your questions about weight and weight medicine. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medications, and if you want medically based answers to your weight questions, you are in the right place. So welcome. I'm so delighted to answer your questions today. And thank you all for a wonderful January office hours every day. You all had amazing questions and it was so fun to answer them. And I'm definitely going to do it again soon. So, and I'm going to, of course, keep answering the questions in the weekly office hours, but I will definitely do another daily office hours again soon. And I'm definitely going to keep doing the YouTube office hours as well, just not every day for this month, but definitely at some point in the near future, I will do an office hours every day again. I'm going to start with the questions for today. And as always, as a disclaimer, I can't answer personal medical questions because I'm not your personal doctor. So if your question is a little personal, I'm going to change it a little so it's a little bit more broadly, educationally relevant for people. And let's get started. So first question, since being on Zepbound for the last 3 months, I've noticed my urination frequency seems delayed and less often versus when I wasn't on it. I've actually increased my water intake from 96 ounces to 120 ounces since being on Zepbound, and curious as to why this happens. I agree. That would be very curious if I had a patient coming in who's telling me they are increasing their fluid intake and their urine output is decreasing. So, one thing that Zepbound can cause is what's called acute kidney injury. So, an acute kidney injury is kind of a broad term for many different kinds of exactly what it sounds like acute problems in the kidney, and often, especially with the GLP-1 medications. Often this is due to dehydration, which causes a limited injury of the kidney that can be corrected. But if people are vomiting a lot, if they are having diarrhea, if there's a lot of volume loss and you're not keeping up with it, that can be very serious for many organs in your body, and your kidney is very sensitive to your fluid status. So certainly that can be affected, but it sounds like in theory, for a case such as this, that would not be the issue because the water intake has increased. So if I had a patient coming in who said, hey, I'm on Zepbound, I'm drinking more water and I'm actually urinating less, that's definitely somebody I'm getting labs on. That's definitely somebody that I am checking a urine on and maybe having see the kidney doctor. It really depends on what's going on, but it's definitely something that I would want to work up more. Also, as a side note, even though Tirzepatide and the GLP-1s in general, can have this effect of acute kidney injury, a lot of times they are shown to be beneficial to the kidney. So they help with kidney inflammation. They help with kidney damage. Like if the kidney's very damaged and it's losing a lot of protein, it can help with that. So usually they're thought to be, except in these cases that I talked about, usually they're thought to be very helpful to the kidney. So this is unusual. I do not have patients coming in complaining about this to me. Now, whether they have noticed it or not is one thing, but it's definitely not something that I hear much of at all. So, yes, of course, there are topics that we've discussed before that people out there, not everybody is a textbook patient, right? Not everybody's going to have the exact same side effects that are listed. Are some people, because millions of people are on these medications now, there are going to be side effects that, come up later that we didn't realize, or more people have than we thought had. And that's just we're discovering because of the sheer volume of people that are on these medications now. And that is not to be unexpected. That's just kind of what happens in medicine. But all that is to say is it's potentially something that a lot of other people could be struggling with as well. And it's because it's not, acutely alarming. They might not be going to their doctor with it. So what a great question. But if that patient came to me, I would definitely be checking labs and urine for sure. Okay, next question. I've been searching high and low for anger side effects. Can't find any information. Help. I've been on Mounjaro for 15 months at 12.5. I'm 47. My gynecologist put me on HRT, thought it might help with my moods. I've lost 125 pounds. I want to lose way more, but no particular goal. Wow. Okay. So, congratulations on the weight loss success that you've had, but definitely it sounds like you are having some distressful side effects from something. So, this is another one. I don't really have people coming in angry, but there is kind of this known, most of the time, people's moods get better with Mounjaro, with semaglutide, with Zepbound. Their moods get a lot better because they're losing weight, they're feeling better, and in general, that's the trend. But every once in a while, I do have patients that say, oh, I went up on this dose and I kind of didn't feel great. And usually it's pretty mild. They're like, I felt a little down, or, I didn't quite feel like myself. And that the mood changes can happen. I would say it's pretty rare in my experience, but they are known to happen. And there are warnings on the GLP-1s that there can be some mood changes. Now, that might include anger. I have not had any patients who come in saying they're really angry. But the mood changes are a thing. Mood changes for some people may manifest as anger. I will say also, if I had a patient coming in saying they're feeling really angry, of course I'm going to check labs, but I'm also going to check, their other medications, because certainly there are other weight loss medications that can make people more irritable or angry. So things like a lot of the oral medications are more stimulating, and that can really push some people into being more irritated, or that sort of like anxious irritated. And I had one patient call it, she said her husband called her a Fentermini when she was on Fentermine, because she just got really, really angry and she lost her filter, and she just was saying things that she wouldn't normally say. So if I had a patient coming in angry, I'm also going to check their other medications, because those can definitely be having an effect. So labs, other medications, I'm checking their blood sugar. Is their blood sugar dropping a lot? Because that can make people very irritable. So it really requires a little bit more deep digging. But also there is a warning on the GLP-1s that the mood changes can be, every once in a while, they can be severe. And I have seen that very, very rarely, but it does happen where people can have much more severe mood changes. Of course, you have to rule out all the other things, but it's not outside the realm of possibility. Another thing to think about, if I had a patient coming in with mood changes on a GLP-1, is did they have this on different doses, or is it just showing up now? Because sometimes if I have a patient, they're not feeling great on a higher dose, it might, for my treatment, it might just be dialing them back and keeping them on that lower dose for a couple more months and then going up and trying again, or just keeping them on a lower dose if they decide, you know what, that was too much. I don't want to do that. And we don't think that side effect is going to go away. So the short answer is yes, mood changes can happen. Rarely they can be very serious. And is it outside the realm of possibility that a patient could come in and be extremely angry on a GLP-1? Absolutely not. Do I see it a lot in clinic? I absolutely do not see it, but it definitely could happen. Definitely something that I would want any patient to consult with their prescribing physician about, for sure. Next question. I'm 49 and fairly active. I'm up to 249 and can't get my belly to go down. I have muscle separation in the middle of my stomach and don't know how to get it back down. Okay. Thank you for sharing that. So I think what you're describing, so a lot of people when they are gaining weight, they're gaining it. And I think we've talked about this before. There's two kind of main ways that we store fat. There's the subcutaneous fat. So that's the fat that you can pinch, right? And then there's visceral fat. So visceral fat is when people feel like they have kind of like this, their belly's a drum. Like they can't reach the fat on the outside. Like there's some subcutaneous fat, but it's really behind the kind of abdominal cavity. It's really like inside, deep inside where the internal organs are. And so if somebody has a lot more of that visceral fat, which by the way is more harmful because it's closer to your internal organs. And so that's more inflammation that's closer to your organs. So given the choice between the two, you'd much rather have less visceral fat and more subcutaneous fat. But for people that have that, it can it can exert more, pressure. And so if it's exerting a lot of pressure, that could cause a hernia. Sometimes, so a hernia really means like tissue that's poking through, like the tissue that holds everything in your abdomen and your groin, lots of different places. But for today, we're talking about your abdomen. The tissue that the fascia, the layers of thin tissue that keep everything kind of sealed in, gets weakened, can be weakened by a number of different things. But in this case, it's usually, pressure from excess weight, from excess fat. And so sometimes the tissue can poke through a little bit. So people can get these kind of like bumps or kind of like protrusions from their abdomen, and it's called a hernia. So sometimes that can happen for people. Sometimes, I'm not sure if that's what you're describing. Sometimes it's just the weight is the weight itself is evenly distributed, but that's kind of the last place that somebody is losing the weight for that person. So in either of those cases, if it's increased visceral fat but there's not a hernia, or if there's increased visceral fat and there is a hernia, essentially the first line treatment, if I had a patient coming with that, is really focusing on weight loss. And so if somebody is, and of course, always you want to start, if you can, with the lifestyle changes. So are you exercising how you want to exercise? Are you eating how you want to eat? Mostly plants. I'm not going to go too much into like nutrition here, but you want to really make sure all that is where you want it to be. And then for a lot of people, that is where medication is very helpful as well. Now, if it's a more urgent case, like somebody really needs their weight down sooner, or they've tried a lot of things, or they're really having a hard time sticking to exercise routines or lifestyle changes, or that's kind of really where they want it to be. And this comes up a lot for people. They're doing all the things that they want to be doing, and they're not really noticing as much of a change as they would expect with the medications. And of course, that comes up for a lot of people as well. That is a great place to talk with one's physician about potentially their candidacy for one of these medications, because they can certainly be helpful. And especially for hernias, sometimes they need surgery, but sometimes they don't. So, and weight loss, you don't really know a lot of the times until you lose the weight whether somebody would need surgery or not. So those are the places I would start. Lifestyle changes, see your prescribing physician, your primary care doctor, who may be able to prescribe these for you, or you can search the directory, if you're in America, the American Academy, the American Board of Obesity Medicine for your state. Get a whole list of obesity medicine certified doctors. Or in your country, they may have something similar if you're not in the United States. So that's where I would start. But either way, weight loss is the key to reducing that visceral fat that is very problematic. And for a lot of people, they do need a GLP-1 medication or an oral medication. But of course, as we've talked about many times before, we know that the GLP-1 medications are the strongest and most effective medications. And so that is where a lot of people would benefit starting one of those medications. So what a great question. Thank you so much for sharing that. Next question, okay, this is a follow-up to a YouTube short that I put out during the office hours January, which was about signs of hypoglycemia. It was about a medication, somebody who was on Zepbound who was dizzy. So you can definitely check out that. I think it's like Zepbound, dizziness, dehydration. There's a YouTube short about that. And I was talking about reasons why they might be dizzy on Zepbound. And somebody wrote in and said, how about dizziness is a possible sign of hypoglycemia? Do realize it is rare to ever get hypoglycemic on a GLP-1 alone, but for people who are on a GLP-1 plus another med or meds that control glucose, such as metformin, it seems like a thing to watch out for. So yes, that is exactly right. I did not mention that, and that is very important because somebody who is, if somebody doesn't have diabetes, you are much less prone to hypoglycemia on a GLP-1 medication. And if you have type 2 diabetes, there's a much greater possibility that you can be affected by low blood sugar or hypoglycemia, as it's called, when you're on the GLP-1 on its own or an interacting medication. But as this question points out, sometimes people are on a GLP-1 and something like metformin, which is a diabetic medication. And so, yes, you certainly have to watch out for that as well. And it certainly could be a cause of dizziness. So if somebody's dizzy on a GLP-1, you also do want to think about blood sugar. You do want to look at I do want to look at their other medications. I do want to know what they are eating, because a lot of times people, especially in the early stages, some people are not eating a lot. And that is something that I really watch carefully, because what I don't want is people to go on these medications and then have like 3 bites of food and get malnourished. That is not the goal. So the short answer is yes, you would also want to think about low blood sugar or hypoglycemia as well if you are dizzy on one of these medications. So thank you so much for bringing that up. Thank you so much for watching. If you have questions afterwards, I love answering them. So you can leave them on this video. You can leave them on another video. And I do office hours every week. So if you want to work with me directly, a lot of you know that I am an obesity medicine doctor, but did you know I am also a life coach? So I help people around the world, people who live outside the state where I practice. I help them with the non-medical aspects of their weight loss as well, because so much of that is related to weight and weight gain. And so if you want to talk with me about how to work with me directly, you definitely can. I'll leave that info below. Thank you so much for watching, and please be well.